So, sir, what tests do we do prior to starting biologics?
Now, biologics are very good medications available to control the disease process in ankylosing spondylitis. The basic problem in ankylosing spondylitis is inflammation, destruction of the vertebra, new bone formation. So there are three components. So all these three components are controlled by the administration of biologics. They are very wonderful drugs. But one thing we should understand in life, anything which we take for an effect has also a side effect. A classical example, no, all of you would have got married. Marriage is a very pleasurable act, but it also has got side effects also. Everything. So similarly, biologic medications are medications which can suppress the body's defense system. Now, if suppose I get COVID infection today, my defense system will go and fight against the COVID and I will not get COVID at all. If my defense system does not work, COVID infection will become COVID disease. I may develop pneumonia and even die. So biologics are capable of suppressing the immune system to some extent. When they suppress the defense system, then what happens? Our body is prone to develop infections. There is one particular infection which is quite common with biologics, and that is tuberculosis, especially in developing countries like India, so many other places like Africa and all, where TB is common. TB is common. TB is not common in US, it's not common that much in England, but it's common here. So before anybody goes for biologics, the doctor will first ask you whether he had any TB, whether he was treated for TB, whether there was anybody in the family who had TB and was treated for that. That's very, very important. History of TB will be taken by the doctor and recorded. And history of other conditions like any malignancy, whether he's on immunosuppressive drugs like steroids or anything like that. The doctor will clinically examine you to find out if you have any problem, any sign of infection. I'm going to tell the simple test later, but one important test is all patients with ankylosing spondylitis prior to the administration of biologics should have a complete screening for TB done. So first it is a history screening, then it is a clinical screening which includes examination even of the lungs, for lymph nodes, for temperature, etc. Asking for symptoms, whether the patient has got prolonged fever, loss of weight, loss of appetite, persistent cough, coughing out blood. That's a very important. All these things we'll ask. Then we send him to the laboratory. In the laboratory, there are three important tests which they may have to undergo. The first one, this TB is a microorganism which will go and kick the immune system, and the immune system will produce antibodies against the TB bacillus to go and kill it. Now, this immunological process can be detected by doing a skin test. Some of you have taken biologics. Sir would have asked you to go to the laboratory and do a man-tooth test called a tuberculosis test. They do it in the forearm. After 72 hours, they will read the forearm and they will say it is a positive man-tooth when it is more than 10 millimeters. Man-tooth, the greatest advantage, it is available everywhere, including a village. It is very, very cheap. And in fact, it is quite representative that this person has been exposed to the TB infection sometime in life. Suppose my man-tooth is positive, it does not mean I got active TB. It only means Dr. Ramakrishnan has been exposed to the TB organism at some time, or I had a BCG vaccination which has been given. Nowadays, may not be there, but in the later days, all you people would have had BCG vaccination. So if you have had BCG vaccine, your man-tooth test can be positive. If you have been exposed to TB bacillus, your man-tooth test will be positive. Remember, just because my man-tooth test is positive, it does not mean that I have active TB. It means only I'm exposed to infection. But this is a condition called latent TB. Just remember the word latent TB. Second, we do a blood test for TB. That is called gold interferon test, TB quantiferon test. Now, this is very easily done, but it requires specialized laboratory equipments to do. It is quite costly. You require only one visit. Man-tooth, you require 2 visits to the laboratory. and it is a better dependable test than the man-2 test. It can be positive, even can be even in a BCG vaccinated person. There is no problem. If the TB quantiferon is positive, it means the person has got latent TB. So we have to do these two tests. You can ask me one question, Ramakrishnan. I don't want to spend a lot of money. I will do only the man-2 test. It is cheap. Let me tell you, all of you ladies and gentlemen, in India, you have to do both. If facilities are available to do the gold TB quantiferon, that also has to be done. If it is not available, it's all right. We compromise with everything in life. We will do a tuberculin test. So if a person is positive man-2 test or TB quantiferon test, or is positive for both, with normal X-rays, no symptoms at all of TB, we call it as latent TB. The other important thing, all patients given biologics will have to take an X-ray test to find out if they have any silent involvement of the lung. Only if they have an involvement of the lung, we will contemplate to do a CT test, which is quite costly. We all do only man-2 test, TB quantiferon, and we do an X-ray test. This is very, very important. Then after that, before you give any medicine, you have to do routine test. No, you should do a complete blood count, ESR. C-reactive protein is a test which is done to show whether you have active disease or not. Then when you give a biologic, after 3 months when you repeat the CRP and the CRP is coming down, it means your disease is responding to the biologic. That's very, very important. You have to do tests for the liver, tests for the kidney, a urine routine. Now, one important point, some biologics have a tendency to involve the heart. So it can cause cardiac failure. I have seen patients like that way. So you must ask for a history of cardiac disease. Everybody we get a routine ECG done. In necessary cases, we get an echocardiogram done. So these are all the tests which have to be done. And very, very important, you should ask them whether they have TB and whether they are taking any TB treatment. That's very, very important. Another important question doctors will ask is, does anybody have active TB in the house?